I wanted today in this video to talk a little bit about how our pelvis and the positioning of our pelvis affects our back and often causes back pain. So in our society, we spend a lot of time sitting down, okay? Women wear high heels, and all this has an effect on the position of your pelvis. So in subsequent videos, we're going to discuss a little bit of anatomy. We're going to discuss force coupling and how these have an effect on your pelvis, which also has an effect on your spine. So to illustrate the force coupling that happens on the pelvis and the hips, because your back is controlled by the pelvis. And basically the pelvis is held in place by 4 different muscle groups, okay? You have the abdominal muscles attaching to the top of the pelvis from the front. You have the hip flexors attaching from the bottom on the front. You have the hip extensors, or the gluteals, attaching from the bottom in the rear. And then you have the back extensors attaching to the top of the pelvis in the back. So I'm going to use this model that I made with this ruler and some strings to illustrate the pelvis. Okay? So we'll call this the abdominals. This string represents the hip flexors. This string represents the lumbar extensors. And this string, the glutes, or the hip extensors. So when these muscles couple, if you have tight abdominals and tight hip extensors, your pelvis is going to tilt this way. They're going to couple. That would be called a posterior pelvic tilt. If you have tight back muscles and tight hip flexors, it's going to tilt the other way, into an anterior pelvic tilt. Okay. The idea, the whole goal here is to have everything equal and in balance so that you don't have a tilt one way or the other. So what happens in today's society, in the way that we handle our lives, okay, most of us are in a sitting position, and I'm going to demonstrate also what ladies that wear high heels, it compromises our hips and changes the way our pelvis is level or not level. Most of us in a sitting position, right? Notice what's happening with my hip flexors. My hip flexors are tight, and my back is tight. This forces an anterior pelvic tilt. Tamika. A lot of ladies like to wear high heels, and by wearing high heels, you can see what that does to the pelvis, how it's also going to do an anterior tilt forward. Okay. So, when we have an anterior pelvic tilt, what does that mean? It means that the hip flexors are tight, and the back muscles are tight, so it's pulling the pelvis this way. So that means we need to stretch this, strengthen abdominals, and strengthen gluteals to pull that back into place. If it was the other way around, if the pelvis was tilted back, that would mean we have tight gluteals, tight abdomen, and this being stretched and this being stretched, which means we have to do the opposite. Strengthen, stretch, and stretch to get it back. Okay, so the first thing we're going to do is demonstrate some exercises to make corrections for the most common pelvic tilt that society has, which is anterior. Remember, first thing we have to do is stretch the hip flexors. Here's one that can be done at home. Okay, going to assume a kneeling position. Going to go ahead and lift the heel, grab the heel with a foot. We're going to tilt in. You will be feeling a stretch on the hip flexor over here, and what you do the other side, we'll just repeat with the other side. Each stretch we're going to hold for approximately 30 seconds, 30 count, and about 2 to 3 repetitions. Okay. So the other group of muscles that need to be stretched with an anterior pelvic tilt is the lumbar extensors. One real easy way to do that at home is to have the knees bent, arms out at the sides, and just do a roll to one side as far as you can go, as long as the shoulder blades stay down. And she should be feeling a stretch through the lower back into here. She'll hold that for a 30 count, and then repeat with the other side, approximately 2 to 3 times. Also groups that need to be strengthened with an anterior pelvic tilt. First one is the gluteals. Okay, what we're going to do for that, supine position, knees are bent. We're going to spread the feet out apart about 6 inches. Okay. We're going to be on the heels, toes up, okay? Arms at the sides. What we're going to do is lift the hips straight up as high as you can go, Squeeze the gluteals. We're going to hold that for a count of 5. 1, 2, 3, 4, 5, and then relax. Okay. Should be feeling it down here in the gluteal. Yes. Okay. Repeat for 10 repetitions, approximately 3 sets. Okay. The other muscle group that needs to be strengthened is the abdominal group. Easy way to do that from the same position. We put hands on the thighs, both hands. We're going to try to take the middle finger and reach the top of the knee. In order to do that, the shoulder blades are going to have to come off the mat. So we're going to reach up. Okay, so that basically is a crunch. One way to accentuate the contraction is to breathe out on the way up, like you're going to trying to blow out a candle at the top of the movement. Okay, so and in, and out, and in, and out, and in. So basically 10 to 20 repetitions for 3 sets for the abdominal group.